I've got a hot take about starting solids. You see online everywhere where people are talking about baby-led weaning, and a lot of the times what they mean is to use real whole foods when you're starting solids. Skip the puree, just go straight to whole solid foods. And while in theory, I understand that they want babies to lead, they want to be responsive, we want kids to eat the foods that we're eating, and I totally agree with that part of it. But my hot take is that sometimes if you start with whole foods, if you start with chewable solids, if you start with big pieces of food, this can actually lead to some kids being pickier or even having oral aversions because they were not developmentally ready for this. Almost every pediatrician that I talk to will tell you to start solids between 4 and 6 months old. And this is in alignment with the guidelines from the AAP. The thing about starting solids between 4 to 6 months old is that people don't understand that if you're starting closer to that 4-month-old range, a baby is likely not developmentally ready for anything other than purees. They're just not there yet. However, if you're starting closer to 6 months old, you may have a little bit of wiggle room there. With that being said, it's still individualized per child. And I say this because online you will see a lot of all or nothing, right? Use whole solid foods, skip purees entirely. If you use puree, you're doing spoon feeding. My favorite approach is combo. This is where we are using a mix of both. And a lot of the times this allows for better individualization of food preparation based on a child's developmental needs. If we present a child with food repeatedly that they're not developmentally ready for, they're not going to be interested. They're not going to want it. And I'm not saying that we're not going to allow for some gagging. We're not going to allow for spitting out some food, for trying to figure it out. Of course we are. But if every single time the child has a food, they gag, it's horrible, they're gagging to the point of vomiting repeatedly over and over and over again, that we should not have happening. We might just have to take a step back before we move forward with more advanced textures to make sure that we're also supporting the child in their self-efficacy so they feel confident and they feel comfortable in accepting those foods. My hot take is it's not all or nothing. It's okay to have some flexibility and variability in there. The biggest thing is making sure that slowly over time, we are advancing textures. We are giving a variety of flavors and shapes and colors and all the different foods that we eat in order to promote a more well-rounded variety. And you can do all of those things and your child will still have a picky phase called neophobia, which is developmentally appropriate. It's not your fault.